All righty, part two of our series on prevention and the science of prevention and the seven strategies or eight strategies of community change. And we're on providing support. So let's get to it. Providing support means to provide support to schools, parents, caregivers, as well as other prevention providers with the marijuana to have that talk guidebooks. Now, we can pick different initiatives, programs. It doesn't always have to be the one, but if this is in our plan, then that will be approved by. And this particular grant comes from the Tennessee Department of Mental Health, the Division of Substance Abuse Services. And they build their programs on evidence-based strategies as well, and the SPF model, which is what this is. So looking at the providing of support, that means we would go into our prevention educators, would go into schools, organizations, talk with our stakeholders, other community groups that we collaborate with, and provide guidebooks and open forums for them to sit down and have discussions about what we're talking about in this segment is about marijuana. We would also provide prevention resources to the school system, like DVDs, stats, graphs, posters, and talking about the misuse of marijuana. And in Tennessee, it still is illegal, by the way. And some of the stuff in the stores with the THC, as you might not or may not know, but there are laws that have been passed recently that were in effect on July the 11th of 2025. And it takes about a year for those things to get on the TCA code and develop into an actual law that will be passed on down from the DA's office into the law enforcement offices to the streets to the cops. And so you will see some changes, hopefully, soon in some of the vaping stores, and they will no longer be selling garbage to people. Excuse me. I had to use that word. There's no other word. I could say a word, but I'm a preacher and I don't cuss. So anyway, reality of this is these products are above. We've had several of them tested by the TBI, and they are above the legal amount, which is 0.03% to be sold in a capacity of THC and vaping. Oh, goodness. There's so much junk that they've developed that it just blows my mind. But anyway, we provide information, and when they ask us questions, guess what? If we don't have an answer, we're going to have another workshop, and we're going to find the answer for our community. That's what we're here for. We're not just paid to twiddle our thumbs and talk out the top of our head, like talking heads, like we're, a lot of information. These things actually work. I mean, they're logic. I mean, if you want to fix something in your house, you're going to find which tool to use and what product to use, right? Whether it's your dishwasher, your refrigerator. I mean, you have to find a plan and the proper tools to fix it, right? That's how it works. All right, number 5 is going to be increase your barriers and reduce access. Oh boy, that's a good one. So this means provide and promote drug-free activities for the community. We are getting ready to do a 5K in our community, and this will we want to do a fundraiser to provide some extra funds for our DCS. We're looking at doing that maybe in the springtime. For kids that are sitting in the DCS offices, there's still a large amount of them that do not have what they need as far as some comfort and some encouragement. So we're going to try to dive in and help out with some of those needs as well. All righty. That would be to increase a barrier. All right. Number 6 is to reduce barriers and increase access. Provide materials on all printed and electronic materials to the community about the red line. What's the red line? Well, that's a very good 888 number that you can reach out for help 24/7 for if you're having an issue with addiction or anything to do with mental health. It's a very accessible and it is very effective as well. All right, that's reducing a barrier. Provide a list of resources for marijuana prevention within the community, including support groups, teachers, counselors, youth parents groups, alternative activities, mentoring, and opportunities, etc. In other words, increasing the access to building up educational concepts for community partners so that their perception of harm, remember that was going to be our process indicator and intervening variable. That was going to be the very thing that was going to measure, like the measuring stick that you're going to measure. And let's look at how the parents think about this. Well, we actually have data that tells us a lot of different things that parents do see that one thing was tobacco was highly perception of harm. So we've worked very hard along with our health department and other prevention educators to provide information to our community about tobacco to the point where in the early 2000s, I think it's more like 2018 maybe, that our stats went from 40% in tobacco use to down to in the 20% percentile. That's pretty cool. That's pretty effective right there. That's almost half. So it can be done in a community once they get educated and understand what is happening and what these products could actually do to them, which is tobacco, whether it's CBD, whether it's THC that's concocted in these stores. And so that's what we're here for, is to help provide these tools to our community. Then number 7, changing incentives and consequences. Hold recognition events for coalition members, volunteers that actively participate in strategies. Provide Have the Talk certificates to parents taking part in the Have the Talk program. Changing incentives. So again, we're looking at low perception of harm. So how would low perception of harm, how would having that talk, meaning providing some tools and language for parents to have that they can engage their teenagers in a conversation without them feeling threatened or talking above their head or, causing that generational gap kind of thing. So, of course, every single parent, every single home is different, and you have to find what's pliable for your children and for your community. All righty. In conclusion, changing the physical design of the environment. All righty. That's a big one, really. A coalition will provide youth-designed anti-marijuana posters for display in local organizations and businesses, and also install billboards with MJ prevention messaging in different areas of the community. Posters that provide just basic information, billboards, etc. Boy, I'm going to tell you, we did one on marijuana, and we got 2 that we had at billboards, and we got a lot of response. I understand the gap between people who are pro marijuana and those that are con against it. And again, we don't take political stances for any reason other than we are promoting the solution, and we are providing you with the facts of what have been proven by data, statistics, whether it's ER, overdoses, whether it's, your DUIs. Unfortunately, even THPs, car accidents, things like that have to do with marijuana. And I really am just going to tell you what I think. I'm really sick and tired of hearing people say that marijuana is a solution to the problem. Look, I'm just going to tell you, pills weren't really a solution, and I do realize people had to use pills because they're in severe pain. I'm not throwing out the baby with the bathwater, okay? I'm not going to be a pharmacist, but I will tell you, it's always less is more. And if you are a sick person and you need some medication, you can get THC provided to you over the counter. So if there's going to be any regulation whatsoever, my professional opinion as a prevention practitioner and what I deal with that, because I also have a crisis center and I also have clients in recovery. And I can tell you 1,000% that largely, whether you like to hear the word or not, yeah, it was a gateway drug into heroin. Oh no, my Uncle George, he used to smoke weed, and he's still smoking, and he's 155 years old, and he never went to heroin. Okay, whatever. Look, I'm not trying to knock you, but I'm just going to let you know you're playing with fire either way. Anytime you hit that dopamine button in that brain of yours and you set it up, whether it's tobacco, I don't care what it is, if it's something that's going to set off dopamine and you like it, because us human beings, we like to feel good, okay? I love to feel good. I don't like to feel bad. So I understand that. But on the other side of this, let's look at the longevity and the health benefits of what's going to make us live longer. I can 1,000,000% tell you anything that you're breathing into your lung tissue. No, I'm even careful about cleaning products. So let's be real, people. I know you're defensive. I know there's people that are suffering with cancer and they've had to use these products, and that in my feeling of that is fine. And sadly to say, if those people are in a hospice and they are declining and they're no longer be living on this earth, just keep them out of pain 100%. But if they're thriving and wanting to raise children and drive cars and work machinery, and they don't want to be their arms amputated and have car accidents and kill people. And yes, by the way, I do know people, and I know of a distant family member that lost their life, and it was due to the fact that they were using the person that was driving. They lost a baby, and they also lost their lives because of their loved one who was driving, and now he's charged with 2 vehicular homicides. Yeah, it was marijuana. So, my bad. And I don't mean to say that flippantly, but it just makes me a little frustrated when I feel like people think it's just okay, like it's just bubble gum. Anytime we put any substance, my friend, into our bodies, whether it's legal or not legal, we have to understand that we give away a part of our freedom. I hope you have a blessed day, and we'll be talking again soon. Thank you.